Hi, my name is Mary Claire. I'm here to do your assessment. I'm going to start out by inspecting your hands and your wrists and your elbows and your shoulders, upper arms. Alright, now I'm going to start by palpating your hands. So I'm going to palpate the metatarsal interphalangeal joints. Then I'm going to do the proximal interphalangeal joints on both sides. Then I'm going to do the distal interphalangeal joints. And then I'm going to test your range of motion. So I want you to extend your fingers, make a fist and flex, hold up the number 4 for radial deviation. Alright, and then I want you to squeeze my hands, and that's going to test your strength. Now I'm going to palpate your wrists. So this is the carpometatarso-phalangeal joints. I'm going to palpate the dorsal and volar side. Alright, and then I'm going to test your range of motion. So I want you to lock your elbows by your side, make a fist, and I want you to extend and then flex. Splay your fingers, and then I want you to radial deviate, ulnar deviate. Alright, and then I'm going to test the strength of your wrists by pushing down and then pushing down. Okay, good job. Now I'm going to move on to your elbows, and I'm going to inspect your elbows. So I'm going to palpate the olecranon process and the epicondyles. Palpate the olecranon process and epicondyles. Alright. Now I'm going to touch the range of motion of your elbows. I want you to extend and then flex. Then I want you to lock your elbows by your side, and I want you to splay your hands and then supinate and pronate. Supinate, pronate. Okay. Then I want to test the strength of your elbows. So I'm going to have you put your elbow back up and then resist more pressure, and then resist more pressure, and then resist more pressure, and resist more pressure. Okay, now I'm going to palpate your shoulder joints, so the sternoclavicular joint, the acromion clavicular joint, sternoclavicular joint, acromion clavicular joint. Alright, now we're going to test the range of motion. So we're going to flex, extend, we're going to abduct, adduct, then we're going to test the external rotation, external, internal. Alright, now I want you to hold it up like this. I'm going to touch your strength, so if you can push against me, and then push against me, and push against me, and then pull against me. Okay, now we're going to move on to the lower extremities. So I'm going to be stand up. I'm going to inspect the joints and legs, the lower extremities. So I'm going to inspect the hip, the knee, the upper leg, the lower leg, the feet, the ankles, the hip on this side, and the feet on this side. Now I'm going to palpate the hip joint. So I'm going to palpate the greater trochanter joint. And then we're going to palpate the greater trochanter on this side. Alright, now we're going to do the range of motion of your hips. So I'm going to have you flex, extend, and then we're going to abduct, and then adduct. Then we're going to bend the knee, and we're going to externally rotate, internally rotate. Then we're going to do the same on this side. So flex, extend, abduct, adduct, bend the knee, external rotation, internal rotation. Now I'm going to test the strength of your thighs. So I'm going to have you push against me, pull against me, push against me, pull against me. Alright, now I'm going to have you sit so I can test your knees. So I'm going to have you relax completely. I'm going to palpate the femoral tibial joint. Tibiofemoral joint. I'm going to feel the patella moving up and down. Alright, now I want you to extend your knee and flex it. Flex, extend. Flex, extend. Now I want to test your knee strength. So I want you to push against me. Pull against me, push against me, pull against me. Alright, now we're going to move down into the ankles. So I'm going to palpate your malleoli, your Achilles. Alright, and then we're going to have you plantar flex, dorsiflex, eversion, inversion. Now resist my push. Push against me. Alright, and then we're going to palpate your metatarsal phalangeal joints. Alright, then we're going to do the proximal interphalangeal joints, proximal interphalangeal joints. Then we're going to do distal, 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 distal interphalangeal joints. Alright, and then I want you to extend your toes and then flex your toes. Okay, now I'm going to have you stand back up and we're going to move on to your spine. So I'm going to inspect first from the posterior side, making sure there's no lateral curvature. Then from this side, making sure there's no kyphosis. Then I'm going to palpate her spine, doing the extensor muscles all the way down the back, on both sides of the spine, all the way down to the sacrum. Then I'm going to percuss the spinous processes. Then I'm going to percuss the costovertebral angle. And then I'm going to test the cervical range of motion. So I'm going to have you extend your neck and flex your neck. And then I'm going to have you laterally extend, and then rotate your head from the left to right. Alright, then I want you to turn around again and I want to look for some scoliosis test. So I'm going to have you bend down very slowly, looking for how the curvature happens in the spine, making sure there's no lateral to it, and then come back up slowly. Alright, and then we can test your lumbar rotation. So first things first is we're going to bend down again for flexion, and then extension is backward, lean back. Okay, then we're going to do lateral flexion, and then we're going to test your rotation from left to right. So twist your upper body and twist your... Okay, and then that completes my physical examination.